Many people suffer from sleep disorders. Dr. Rasmus, medical director of Idaho Sleep Clinics, defines the different types and how they can be treated.
Okay, I want to talk to you about sleep disorders, but first, what is non-restorative sleep?
Non-restorative sleep is just the generic term that we use to describe people that wake up in the morning and don't feel rested.
Okay, and what can cause non-restorative sleep?
So a whole host of things can do it. Obviously, wouldn't be restored if you were sleep deprived, but more commonly we think about the sleep disorders leading to non-restorative sleep. Things like insomnia, limb movement disorders during sleep, or possibly obstructive sleep apnea.
And what is insomnia?
Insomnia is the perception or reality that you're not sleeping when you should be sleeping. There's a problem with sleep, and we use the term insomnia.
What is circadian rhythm disorder?
So circadian rhythm disorders are disorders that involve the biological clock, or your circadian rhythm. The most prevalent would be either jet lag, where you pick up and move to a different time zone and your internal clock doesn't match the clock on the wall. And then in the United States, we live in a society where over 25% of the people work shift work, which is also a common circadian rhythm disorder, where people are working in the evening or the night and their body is telling them to go to sleep and their boss or their work is telling them to stay awake and work.
Okay, so are any of these disorders hereditary?
I truly believe that there are good sleepers and bad sleepers, and when you look at families and insomnia, whether it's the genes that are causing the bad sleep or the behaviors that run through families, it's tough to say. But when you look specifically at the circadian rhythm disorders, there's actually been the clock gene that's been identified, and this clock gene gets passed down from family member to family member and can lead you to have a clock that doesn't necessarily match that one on the wall.
Really? Okay, so how do you treat sleep disorders?
So depending upon the sleep disorder, insomnia, for example, we use a lot of behavioral approaches. We use cognitive behavioral therapy. And then circadian rhythm disorders, or the biological clock issues, we can manipulate the patient's clock by using blue wave light or phototherapy at different times of the day in conjunction with low-dose melatonin to simulate sleep in the brain.
And where can our viewers go for more information?
So they can go to saltzerhealth.com, where we have links to our podcast as well as patient education materials.